couple of years ago, cancer of the cervix overtook breast cancer as the commonest cancer among women of childbearing age. And childbearing age is the age between 15 to 49. But majority of cancer cervix actually begin to happen between 40 to 60. That is when we see most of the women who present with cancer of the cervix. Unlike breast cancer, which runs in families, cancer of the cervix does not run in families. If a woman's mother had cervical cancer, it does not follow that the daughter will have cervical cancer. That is very different from breast cancer. Because breast cancer is that if you have it in the family, you are very likely to get it if you are a woman. Cervical cancer does not run in families. But cervical cancer has things that would easily trigger it, or at least quicken its occurrence. And I will talk about that a little later. What I needed to say is that it is that common. It has overtaken breast cancer as the commonest cancer among women. But secondly, cervical cancer is the leading cause of death and illness in Uganda. And if you are looking at cancers, and Uganda is one of the countries with the highest numbers of cervical cancer. In fact, 30 to 40 out of every 100,000 women in Uganda have cancer of the cervix. Now that is a very big number. That's a very big number. If you're looking at a population of around 50 million people, if you divide that with 100,000, 50 million divided by 100,000, that means you are coming to around 50 to 500. If you multiply that by 30, that means we have very many women who have cancer of the cervix. And what has made cancer of the cervix bad is HIV. Because the more we have had a big population of women with HIV, and because of drugs now we have more women surviving HIV, that has increased the number of people we see with cancer of the cervix. Remember, there are two cancers that are very closely related to HIV, cancer of the cervix and hepatitis B. They all move together. They're almost like twins. And that area of the reproduction is where the two cancers are spread a lot. But cancer of the cervix, remember, it's sexually, initially, it is sexually transmitted. There is a virus. This virus is called Human Papillomavirus, HPV. And it's not unusual to hear people talking about HPV vaccine, the vaccine that protects against that virus. This is the virus that begins the changes in the mouth or the gate of the uterus, which is the cervix, that then progresses into cancer of the cervix. So that virus must be present. Without it, the journey does not begin. So much so that if you could protect someone from getting the virus to get to their cervix, you could protect these people from developing cervical cancer.